Hi, everyone. Today, I'm very honored to introduce Janet Ebos. Janet is a registered holistic nutritionist specializing in natural health and wellness through whole foods, lifestyle changes, and integrative health practices. Through holistic nutrition, she addresses underlying imbalances and supports the body's natural healing processes, fostering long-term health rather than just short-term fixes. With a passion for optimal brain and mental health, she received specialized training in the therapeutic ketogenic diet for mental health from Dr. Georgia Ede, the world-renowned psychiatrist and author. Additionally, she studied under Nicole Laurent, the sought-after clinician, speaker, and educator who developed the pioneering course Metabolic Psychiatry for Non-Prescribers. In addition, she serves as a board member and volunteer coordinator for Metabolic Collective, an emerging nonprofit dedicated to mobilizing advocacy communities to raise awareness and improve access to metabolic therapies for psychiatric and neurological disorders. All right, Janet, I really appreciate you coming on for our listeners. Thank you. How are you?
I'm good. Just before the interview, I was out in the sun because I'm in Canada, but all the Americans think that's always so cold, but I'm probably in the more southern part than some of the western states, but you're in Massachusetts, right? So
Yeah, not too
you get
far.
similar weather like Chicago. But anyway,
Yep.
all your listeners will know sun is a metabolic therapy. So I'm
That's
doing
it.
great.
That's
Yeah.
it. That's
Thank
it.
you for having me.
Yeah, absolutely. No, no. The pleasure's mine. And yeah, we got to get that vitamin D when we can get it in this
Yeah.
northern hemisphere, right? So we need this
Mhm.
in summer months. Great. Well, um, yeah, we'll jump right into it. I mean, could you please tell us a little bit about your nutrition practice and how you help your clients?
Yeah, well, I don't think I'm not sure if you even know this, Eddie, but I'm actually a high school teacher. And I started studying nutrition because I was so crazy passionate about it, especially for the brain. And then I just took a program. It took me 3 years, and I'm a registered holistic nutritionist. But halfway through, I discovered that the ketogenic diet, how powerful it was for
Yeah.
the brain,
Yeah.
whether it be for psychiatric illnesses or neurology. And my gateway was kind of Dr. Dale Bredesen, actually. But
Wow.
so I was thinking more Alzheimer's and whatnot. And so as far as my clients, like to answer your question, I I created a website last year and I didn't put my name on, like Georgia Eat has a directory because a global directory because this therapy is not standard of care. And so psychiatrists are very nervous to use this. They won't use it. They're afraid of malpractice.
Sure.
And so they need clinicians to help them get through this safely. And I avoided it. I avoided it just because I have another full-time job. And I thought, I need to put it on there. People are, I was working with the nonprofit Metabolic Collective, which we'll talk about
Yeah.
later, but I'm like, well, why did I take this training? What am I doing? So I put my name in the directory and I must get like once a week local people, which was really exciting for me.
Yeah.
People in Ontario uh, were just really happy to find me. And so I'm really making a lot of connections. And at first I was just referring out to really great keto coaches I know that have had lived experience, have lived through it, and they also have training. And I just meet with them and make them feel like they're part of a community, and I give them a lot of resources. So when you say, what do I do for my clients? I, I'm just kind of starting it. I have to think it through, but right now I'm just talking to people, and I do have a few that I keep in touch with. But I think the biggest thing right now
Yeah.
is I'm just giving them hope. I'm
Yeah.
telling them, listen, I'm meeting people. You can get better.
Yeah.
Trust me.
Yeah.
If you need help with the keto, the therapeutic keto, I can do that, or I can refer out.
Yeah.
But listen, I know this person and that person, and they had a tough life and they are thriving right now. So for me, that's what my practice looks like right now, but I know it's going to evolve.
Yeah.
And
Yeah.
it's the hope. I think that's the biggest thing that I'm
Yeah.
providing right now for
Yeah.
people.
Yeah, I think the hope you provide is really chiefly coming from this wealth of information that it's such great information, but it's not really democratized yet. It's not distributed evenly, and it's very rare to find someone like yourself who's gone through all the training that you've done and then you freely connect all of these people and you seek out all of these experts and you connect them with people who need help, which is great, which is one of the reasons why I wanted you on because and we'll get into what you do with Metabolic Collective and the mission there. But yeah, this is a great time because there are a lot of people who could get so much value and reduce their pain and suffering through these metabolic therapies. So yeah, we'll get into that. You touched on Dr. Dale Bredesen being a gateway. Could you t please tell us a little bit about your mom um, and that experience in caregiving for her?
Yeah, so I would say around 2008, we thought something was up with my mom. Yeah, she was repeating herself and things like that. Um, and I guess it was we were on a trip together to celebrate my parents' 50th anniversary, and I remember the moment she said, "Oh yeah, we were in this look like wherever we were in some square last night." I said, "No, we just got here." And then she even said, "There's something with my memory. I'm gonna go get a test." I went with her. And you might know about those memory tests. I forget what it's called. It's the clock, the one where they draw a
Yep, the
clock and
mocha. Yep, yep.
yep, and I couldn't. Oh, I was shocked. I had no idea because I hadn't wasn't living with her.
Yep.
So she started declining. I didn't know anything about Dr. Dale Bredesen then because I think his work started around 2014. My dad passed away 2013. So then my sisters and I took over the caregiving along with a wonderful caregiver, Adelpha. Shout out to Adelpha, who helped take care of her. And I mean, it's tough. I think it's it's a sad disease for the caregivers because I think I cried more like every day on my way to work, the
Yeah,
thought of her not remembering me and the thought of what's to come. And I think as soon as I turned to gratitude,
yeah,
I stopped grieving uh, and I just enjoyed her as she was alive because she was actually a hoot.
yeah,
Luckily, she wasn't angry. She was so funny and so much fun. We have really good memories of her in her illness.
yeah.
And she ended up passing away 2018 from bowel ischemia, sort of random.
Mhm.
And it's funny because we were thinking, gee, this is tough now. I think she might need to go into a home. Um, just she needed more care.
Yeah,
And the good Lord took her at that time.
yeah,
So, but it was a real honor to take care of her. I mean, but she really wasn't at risk factor for Alzheimer's, I feel. It didn't run in the family.
mm,
And, maybe another time we could talk about statins and, cholesterol lowering drugs and,
yeah,
how she was sort of convinced to go on that. But it's tough, It's really tough to see somebody that you love decline when they had so much energy. Like just she had so much energy and um she still sort of had energy at the end, like physically, but her mind was it was too late for me to do any intervention because I didn't know about any of this, right?
yeah,
Now I do. And for me, my goal now is my own brain health. So I don't want to get Alzheimer's myself since my mom had it. And so I adopt these metabolic therapies for myself and for my brain health.
yeah, yeah. Yeah, no, my heart goes out to you. I'm sorry you lost your mother that way, and it's from one caregiver to another. It is a challenging disease for both the patient and the caregiver, the family that has to experience it. It is amazing that you were able to shift into that gratitude. Um, I think that's such a great way to reframe it, and I've heard that from others as well. Um, and we we've had to do the same thing, right? In being grateful in the present for everything that shows up. My dad's on the protocol, but I've lost other family members before the protocol was available, with a
Yeah.
strong family history. So I'm grateful that the protocol's here and Dr. Bredesen's work is out there. Um, but I'm also very grateful for the kind of work that you and your colleagues are doing because, um, you know, metabolic issues with the brain don't happen overnight. And
Hmm.
there are steps that can further upstream that can be mitigated so that we don't get there, right? And while you're in your story, I know as you're working with your mom, um, then you have to start working with your son, right? So can you please tell us a little bit about your experience with your son and what was going on at that time as well?
Yeah, so around he started showing real and expressing telling me about signs of depression in his high school years. And he it was really tough his first year university. Kind of hit rock bottom, just made it through the first year. And I knew nothing about metabolic therapies at that time, so we visited absolutely every kind of clinician you could imagine. I even went to New York to the Dr. Amen clinic. They're doing some good work too. Like they look at the brain, which is cool. As Dr. Daniel Amen says that they're the only doctors that, like psychiatrists are the only doctors that don't look at the organ they're treating. So they're guessing, right? It's guesswork. And so we went there and got brain SPECT imaging and everything, osteopath, psychiatrist, psychotherapist. I even sent him for healing, like medicine, ayahuasca, just healing medicine. I didn't know. I mean, you don't want to see your son suffer.
Yeah.
Was really suffering. And then he had his first manic episode in 2020. And so then it's like, well, that was a shock because I didn't know anything about psychosis or anything like that. So fast forward to like he's had several hospitalizations for that. And um, he's 26 now. So he really appreciates my support, but at the same time, he's an adult, so he is trying to take this on and think, what's best for him. I have a lot of resources for him. The problem with when we first tried this ketogenic diet, when he was willing, because bipolar disorder is interesting. If you have bipolar 1, you have these psychotic episodes that it takes you out of reality. So you think that you are all sort of all knowing.
Mm.
So you can't tell somebody who's in a manic state anything because they are all knowing. So um, when he was sort of in a depressive state, he agreed to try ketogenic diet. And I was actually getting trained by Georgia Eat at the time. So she was able to chit chat with me every week. But the problem is he was on olanzapine, which is an antipsychotic,
Yeah,
and that is really harmful to your metabolism, and it makes getting into ketosis very difficult. So
that's
he really tried then, and we had a hard time getting him into ketosis.
well,
And gosh, it's a whole story of trying to taper, and the doctor wouldn't cooperate, and my son was sort of biting off pills to try to taper, which is terrible.
yeah,
Like you need a prescriber that collaborates with you.
yeah,
And then he had another manic episode. So, so just like Eddie, he's not necessarily yet.
yeah,
Um, like he says he believes in the keto diet. Because he's talked to all my people. Like they're very willing to talk to him. And he gets counseled by a wonderful person, Mia Mendes. I highly recommend anybody who needs
yeah,
a coach, because not just a keto coach, she, childhood complex trauma training and whatnot. And she has lived experience. So she understands where he's coming from. Um, so so right now I think he's eating really well, but he's figuring it out. So I had to step back.
Yeah.
But I as a parent, um, I'm just trying to live my best life
Yeah.
and be the best role model for him. And when he wants to come over for dinner, come on over because we eat keto in this household.
Yeah.
And my other kids, they don't eat ketogenic diet. So if they want to make rice, they'll make rice. But otherwise, we have pretty ketogenic meals. And so that's where we're at with my son.
Yeah.
And then I guess halfway through my training as a holistic nutritionist is when I discovered that this was even a therapy for bipolar. I was I was just floored. I couldn't believe it. Now it's, you know, I'm in this world. It makes sense when you look at the brain, but so that's where we're at. So it's interesting because my son, this one son, I have three kids, and my mother were very close. So
Mm.
in her Alzheimer's, he was so comfortable with her,
Mhm.
where other people might be a little uncomfortable, right? Because they're silly or whatever, but he was silly with her. He entered her world. And here they are, these two, generations apart. They were like kindred spirits, and they would giggle together and they would cuddle together. And there they both had the same, problem with glucose metabolism of the brain, but presents as two different things. So, and that's what links me to, the metabolic psychology and the metabolic neurology. I'm passionate about both of them.
Yeah. Yeah. Yeah, absolutely. You know, just you're just an amazing mom for an amazing person for um, having to deal with kind of two things at once with two really, really important people you love in your life. And then, it's not lost on me how you kept going to different providers, getting different opinions, getting different perspectives. Um, it's a lot of information to try to piece together and reconcile. I've been in a similar position, but it's amazing that you were motivated to do that for your son, and I'm sure that he's very appreciative for that work and that effort that you've put into that. Um, it it led you to this metabolic psychiatry. So could
Hmm.
you talk a little bit about metabolic psychiatry, what that is, and how that's different to than standard of care?
Okay. But actually, before that, I have a question for you. I know you're interviewing
Yes.
me, but I was just wondering, same with you, because you and I are very similar in
Yeah.
that, we just kept trying. You kept
Yeah.
trying for your dad.
Yeah.
When did you discover it? Like, when did you discover, was it Dale Bredesen who was your
Yeah,
first?
that was my
Oh, okay.
first. That was my first. So I'll tell you, um, you know, it was like for me, it was like grace to a certain extent. I mean, not without a lot of lumps that we suffered throughout that, but you know, it was around the end of 2017 that we started to see some changes in my dad, and it was around the passing of my aunt, who was his sister. So his sister had passed away from early onset Alzheimer's at the age of 57 in 2017. So it was, diagnosis, very quick progression, and she passed away. And around that time, obviously, my dad was very, very down on that, and there was some impairments there that we were helping him compensate with. Um, and I'll tell you that spring of 2018. And I'm sure we'll get into it in another talk. Statins, definitely. I've heard that from many people. It was part of a little bit. He wasn't on statins for too long, thankfully, because from what I've seen, I'm respectful of the science on both sides of that. But from what I've seen in personal experiences, that different people respond differently to statins.
Hmm.
Some
Hmm.
people have an immediate cognitive impairment that is very, very easy to see, and we saw that, and he saw that, and he wanted to get off of it immediately. So there's that piece, but he started to decline in 2018 pretty rapidly because of a couple of reasons, um, and that is when we started looking for answers. And we found Dr. Dale Bredesen because just looking, we found that 2014 paper. And
Mm.
then End of Alzheimer's was published just a few days. It was published and released just a few days in and around my aunt's funeral.
Oh,
So we found End of Alzheimer's, we grabbed onto it, and then we took it from there. And then that led us into the world of learning about the ketogenic diet,
okay. Yeah.
metabolic therapies, mitochondria, all this stuff, right? And so very similar to you, and then just trying to find practitioners that had the competency in these areas, which, as you know, they're there and they're amazing, but it's not like they're everywhere.
Yeah.
So if that answers your question.
Yeah, that was good timing then for you that his paper came out. Well, not for your aunt, but
Yeah.
you know,
It
I
was
guess if you look, you will find. You seek and you will find.
seeking you will find, and I will say it hasn't been perfect because, we grabbed onto it, we went into it full tilt. He was so compliant at the beginning. We got his bind, which was amazing. He was 53 at the time when he was diagnosed with all early onset Alzheimer's. Primary income provider, primary insurance provider for my mother and my
Yeah.
young brother, who my young brother was 15 at the time. But he did so well on it for the first year and a half, increased his cognitive scores by 37%. And then COVID happens and
Yeah.
shuts everything down.
Oh,
And then on top of COVID happening, um, you know, that first alpha variant of COVID kind of hit him hard, started off some seizures. And you know what? It's good you're touching on this because we've had to deal with this. It started a very strange progression over several weeks that then he got sectioned and diagnosed with dementia psychosis. And we know olanzapine, we know Ativan, right? And thankfully, through doing what you did, searching, after a few months, we were able to bring him home. We were able to get him off the medication, and he had a remission, and he no longer has those symptoms of psychosis for a few different reasons, but chiefly because of these metabolic therapies and helping
hmm.
his brain with these metabolic therapies, especially the ketogenic diet. So we'll get into that, but yeah, metabolic psychiatry and neurology very intertwined.
Yeah, very. Yeah, well, to answer your question about metabolic psychiatry and compared to the standard of care, I would say, let's just say, perfect picture. If you have a psychiatrist, you can call them a metabolic psychiatrist that just offers it as an option on the ketogenic diet or metabolic therapy, that would be a perfect world where they need to be trained or work with people. I really understand that they're doing the best with what they know, but they need to be open and find a team and say, listen, there's a powerful intervention on your brain chemistry, extremely powerful that it can stop seizures.
Yep.
Uh, and are you interested in that? We could also put you on this medication. Here are the side effects. I'm speaking loudly because they don't really talk about that. They they are so harmful. Like I know that they're needed, and I thank the medications for the emergency situation with my son when we brought him to the hospital because I didn't know what to do. So I am grateful for those emergency needs. But I think almost all medications, except for, I mean, just for diabetic type 1, they need insulin. I understand that. But for a lot of these lifestyle illnesses, my perfect world of medicine is we're going to give you this medication to help you right now, if they choose medication, and then we're going to taper it and figure out the root cause. So to me, that would be the best standard of care to offer both options because long term, these medications are so harmful on the metabolism. Like people with bipolar, they die 10 to 20 years earlier. Like their lifespan is less, not because of the bipolar. Like people think, oh, suicide or accidents. It's like, no, actually, they're dying of heart attacks
Yeah.
and, diabetes. And like it sedates them. They gain weight, takes away motivation, like all different things. So the standard of care in my area, was not good. I am grateful for the emergency measures, but long term, it's just try this med, try that med, try this med, try that med. And one of the meetings, this is just when I started hearing about metabolic psychiatry, I mentioned Chris Palmer's book, Brain Energy.
Yep.
And the main psychiatrist wasn't interested, but I did see the intern write it down. And that's when his book just came out. And I wasn't trained at that point and I'm not going to sit there and argue with somebody who's not interested, but I just figure, do you know who Ian Campbell is?
Yes.
He's, yeah,
Yes.
okay. So Ian Campbell is I'll just for your listeners, he's a researcher out of the University of Edinburgh, PhD, who is the bipolar mind, researching the bipolar mind as he describes it. And he, we've had talks with Metabolic Collective. He's sort of like, we get the bigwigs to just sort of help inform our direction. And they're so busy, but he came out to one and he just said it has to be a patient-led movement. He
Hmm.
doesn't see it coming from the med schools, so the patients have to keep asking for it. And this is
Right.
growing, right, Eddie? Like
Right.
these metabolic psychiatrists, they're getting on the big podcasts, Diary of a CEO. And I don't even know like if Chris Palmer was on Joe Rogan, or maybe not, but some of the peoples, I call them my peoples, they're getting on there. So if people keep asking for it, then I'm hoping that psychiatrist will say, oh my gosh, because my patients aren't getting better. I'm interested in this. Let me find a nutritionist or somebody who's trained and let me work with them. Give it a try because they want the best for their patients, but it just sounds weird to them right now if they've never heard of it.
Yeah. 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 I
Yeah.
mean, it's it's something that any of these sort of therapies where lifestyle and diet are involved, you would think that they'd be the first in line of treatments to be prescribed and tried, right? Before we get into any of the stronger stuff. And it is hard to break through. And I know I've spoken to so many medical practitioners that feel the same we do, and they say the same thing Ian Campbell says, which is, they're operating within such tight constraints that
Yeah.
consumer demand, it's tough to say it that way, but the medical system very much seems when it's pharmaceutical led, it patients are really consumers, right? So
Hmm.
any market, the only way supply will change is if demand changes and supply will meet that demand. And demand has to change measurably from patients for the medical supply to change along with it. But what's great is there's people doing really, really well. There's people reversing a lot of psychiatric diseases and diagnoses and going into remission and having and thriving because of these metabolic therapies. So, you met Dr. Chris Palmer. You met again. This is amazing. You went and sought out these people. So, who else? Who else did you to seek out,
Yeah.
learn from?
Yeah. Well, I guess it all started, was it last November? I drove, no, I flew out to Boston to a metabolic psychiatry conference put on by Ellen Horn, and not a lot went. Georgia Eade had sent the clinician group just that she was going to be speaking at it, and I said, "Oh, I have to go to this." So there's only 100 people, and I knew Chris Palmer was going to be there. I felt starstruck. I was like, I couldn't even sleep the night before because I was so excited. Like, uh, just going to like a concert of my favorite band or something. And so I already met people on Twitter, like Hannah Warren and Nicole Laurent, and some of those people that are in this movement. And Brett Scher,
Yep.
he's a cardiologist um, that is part of the Metabolic Mind movement. He's the director. And so some of them sort of knew me by name. And so I felt comfortable sitting at a table. Well, then this was the table to sit at. If you on my website, it's the one at the bottom. And I was like just beside myself. And then Chris Ballmer sat beside me. And because I thought, okay, I want a picture. Wait, what did I said? I can't ask for too much. I want to play it cool. So I either want to get a picture or have him autograph my book. So I thought I'm gonna go for the picture. And so I went for the picture, and then he goes, "Do you want me to sign your book?" I'm like, "Oh, well." But anyway, we sat at that table and I just listened. And Eddie, these people, there was no small talk.
Yeah.
These nutritionists, dietitians, psychiatrists, people with lived experience, all one. And they were just trying to solve problems. Like Dr. Palmer had asked one of the dietitians, I have a patient who, and they're talking about this patient. It was like incredible just to listen to. And then Hannah Warren is so sweet. She said, Janet, why don't you tell us about your son? And so we talked about my son, and I sort of got in trouble by Dr. Palmer. He's like, you can't, because you're talking like, just the care wasn't great. And I was taking on a little bit more than he would think I should as because I'm not a doctor. He goes, you're not a doctor. You can't. Like, I said, I know, but
Yeah.
they're not doing it. I think we are talking about tapering, but yeah, so and then Georgia, we knew each other from the clinician as I took training from her, and she has very small groups. So it's only 6 people at a time. And I did the live one. So you get to know her. And then I saw her there and I saw her at another conference. And then Jan Ellison, who is behind Metabolic Mind, who's funding all the research.
Yep.
We have a bit of a bond because of our sons, and she's helped me out even in the early days. We've had, a phone call or messages here and there if I have a question.
Great.
Um, and she's just, I put on X, I saw this meme go around that said a mother does better research than the FBI. I tagged her. It's like, and
Right.
like she's incredible. Her story, I think everybody
Yes.
interested to even to see Matt Bazuki, her son who has bipolar disorder, to see his talk.
Yes.
It's really good. And it shows she tracked everything. I think he'd been tried 26 different medications.
Yeah.
And, one thing that your listeners might not be as aware of because they're more in the neurology world is that in the psychiatry world, people with bipolar, schizophrenia, some, treatment resistant depression, they are putting their illness in remission. There's no symptoms,
Yeah.
and some of them are completely off their medications, have to do it safely. And the younger people can sort of go off the diet. It's sort of like the epileptic children.
Yeah.
They don't have to stay on the diet once their brain is healed.
Wow.
And that's the story with the Charlie Abrams. So,
Yeah.
yeah. So, so if you're younger, you heal your brain, like simple version, and you can eat just a healthy diet after that. But if you're older, it's like with all these lived experience people, they will tell you, like Ian Campbell will say, as soon as he goes off the diet, his depressive symptoms comes back. And all these other people that I've talked to, Robin Dobbin, she's a really good advocate for this. They featured her in the cholesterol code, which I was at the private screening.
All right.
Um, like I mean, I guess originally you asked me how am I meeting all these people, and I'm just going off on a tangent, but
No,
I
no.
just
Great.
kept flying everywhere, Eddie. I'm like, I have to stop. Like, I have to stop doing this. And then Ian Campbell came to Toronto last
Yeah.
month. And I
Yeah.
couldn't believe it. So, of course, it's only an hour from here. So I drove there. And so I keep seeing these people. So um, I just can't stop learning. And so I'm like, no more conferences this year.
No,
And
no.
then but there's one coming up in October I want to go to, and it's in Arizona. So how nice is that? But
Mm.
so that's how I'm meeting all these people. And then I guess, I got involved. I said to Jan Ellison from Metabolic Mind, when I'm done my nutrition program, I would like to volunteer with Metabolic Mind. And then she connected me to Hannah Warren, who's the brainchild of Metabolic Collective. So now I'm just always meeting these people, and I feel like I just feel so grateful to have all these connections. But it's not just the prestige or anything. It's just, wow, we really are all in this together. We really are. These psychiatrists, they truly want to help people. They're not looking to, they're writing books and everything. They have their stories. Like, I don't know if you've heard Chris Palmer's
Yeah.
story. Homeless, he wished he could have helped his mother, who I believe had schizophrenia.
Yep.
Georgia Ede has a backstory. She doesn't talk about it a lot. I talk about it a lot, but you can hear it in, these people have been there, and that's usually the greatest healers because they've been to hell and back. Yeah, so this community, it's a beautiful community.
Yeah.
And people get out of remission, they kind of get ill a little bit, and they have all of us and each other
Yep.
to be supportive, and there's no judgment. I mean, you're dealing with an illness.
Yeah.
So,
Yeah. Yeah, no, absolutely. There's a lot of pain and suffering with anything that has to do with illness, with anything that has to do with not being well physically, mentally, spiritually. But man, when it comes to the brain, whether it's a psychiatric
mhm,
disease diagnosis or it's a neurological, there's a lot of pain there, and the community that's really growing. It's growing every day around this of people like everyone that you just described, everybody, all the practitioners that have rallied around Dr. Dale Bredesen and anyone else who's practicing metabolic therapies and lifestyle and dietary interventions um, to help people. It is such a great community because not only is it's awesome to see people get better. It's awesome to see people reversing Alzheimer's. It's awesome to see people reversing or putting some sort of psychiatric disease that had limited their life or caused
mhm,
pain and suffering. It's awesome to see them put that into remission and liberate themselves. But what is also for me something that is it really hits home is none of this is like set it and forget it. We're all on this path where it takes a little bit of work. There's a little bit of a shared struggle between us all. Lifestyle and dietary interventions are not just a knob you switch. It's
yeah,
it's not just a pill you take. It's not a passive process. And sometimes it's easier than it is hard, and sometimes it's a lot harder, but
mhm,
there is a transformative sort of process that we all have to go through, especially when we're doing it with ourselves and helping loved ones. And I think in that shared struggle, a lot of people are being helped. You're saying, I got to stop going to the conferences. I don't know. Maybe you're called to do that. Maybe you're being called
mhm,
to do that. They need our help. Dr. Chris Palmer and Dr. Georgia Ede and everyone else, they're doing great work and they're helping their patients, and their patients are getting great results, but they need our help too. It takes a
mhm,
village, and we need to democratize the information and evangelize as best as we can. So I'm really grateful that you're doing this work and you're seeking people out and you're connecting people. Um, you talked about the Charlie Foundation really briefly. Ketogenic diet, therapeutic ketogenic diet's been around for at least 100 years, right?
yeah. I guess, like, historically, I think the name they put on, so I know that the fasting worked like in ancient times, right? So they would put seizures in, like, it would stop seizures. It was a tool, I believe. But I think then, I don't know if it was the Mayo Clinic or John Hopkins, where they actually named it the ketogenic diet, and they created, yeah, because you can't just fast. You need,
No.
sustenance. Yeah, so I guess it was in the 20s, and then people forgot about it
Yeah.
because of the medications in the 30s and the 50s, and somebody dug it up. I think it was John Hopkins University or the hospital, the medical center, that somebody found it there again. But yeah, and it was because of the producer Jim Abrams, whose son had seizures like many a day, and many in one day. So because he was famous, got Meryl Streep to act in, do you know what it was called, Eddie? First Do No Harm or something like
First,
that.
you got it. That's it. First, do no harm.
Yeah, okay. And thanks to him, the like this Charlie Foundation, it is now it's now a place for everybody, like metabolic and metabolic psychiatry and metabolic neurology. It's got recipes on there, and it's got like the dietitians that consult there. They're amazing. They they now train. So Denise Potter and Beth Kenya Zupek, they have training for clinicians for ketogenic diet for many ailments like epilepsy, cancer, etc. But now they have a special one for psychiatric. So I want to take that. That'll be my next training. But yeah, thanks to that movie, people rediscovered it because the meds weren't always working. And like we talked about, they have side effects. So I'm glad there's a resurgence of that for epilepsy. And then I would say Dr. Chris Palmer, Dr. Georgia Ede, and Dr. Shivani Sethi out of Stanford. They are the three that really started bringing metabolic psychiatry to awareness. Because I think at the Stanford they have a metabolic clinic. Um, there's so many great things, and then there's the Duke University. So Dr. Westman.
Yes, yes.
Yeah. And that was the big, he was, everybody, so many stories, they just discovered keto by accident because they wanted to lose weight. Not, they didn't discover keto, sorry, they discovered it, put their psychiatric illness in remission because they wanted to lose weight, right? And so they did that with a psychiatric patient in 2009 at the obesity clinic.
Yeah.
And her hallucinations stopped. She
Mhm.
lost weight. Doris, she passed away recently, but she was older, like she passed away in her 80s. And
Yeah.
I think it was from COVID. It wasn't from her illness. So she had her last few years, she had relief.
Yeah.
But yeah, so it was a weight loss trend, and it's a different diet though for the weight loss. It's weight loss diet is more flexible, so it's you want to explore the more medical and therapeutic ketogenic diet and really track ratios of fats to carbs and protein. That's why people might say, "Oh, it didn't work for me."
Yeah.
It's like, well, maybe you were doing the just sort of the weight loss version
Yeah.
and just counting your carbs. So you can't really say it didn't work until you're in therapeutic ketosis and testing for, 3 months at least.
Yeah.
And,
Yeah.
we're not saying it works for everybody, but I would say if you can, give it a try. And it's more than just eating, right? That's the cornerstone, but
Yeah.
it's the exercise, it's the sun exposure, circadian rhythm, community.
That's right. That's right.
Yeah.
Yeah, you're touching on that right now. For viewers who are a little bit less in the know on ketosis, which I mean, ketosis is such a big part of the channel. I don't know how you could how could you get around without knowing ketones as brain fuel here. But you know, could you get into the ways we can get into ketosis? It's a couple
Yeah,
of
I mean, fasting is like a jump start, and
yeah.
you can use exogenous ketones, but I think the science is not quite sure on that. Dom D'Agostini's doing a lot of work with the exogenous ketones, but
Yeah. Yeah.
but you kind of do have to put the work. But yeah, fasting, people that wake up in the morning, they're usually using ketones, especially if they didn't eat like right before. So it's kind of our natural state.
Yeah.
Um, you know, 100 or so years ago, because we did fast a lot. But it is basically eating a low carb diet, like the ketogenic diet, so that you use up all your glycogen stores, and then you are starting to use the secondary um, fuel source, which is ketones, and they are beautiful. They are. so clean and they're so healing. They're neuroprotective and they heal tissues and they don't cause a lot of damage. Like extra glucose causes a lot of damage in the body, like to your blood vessels. And when you have raised insulin, um, your your cells just can't utilize glucose anymore. And glucose has no problem. Like it could get into your brain. It can pass the blood-brain barrier, but the insulin can't. And so you got all these extra glucose in your brain sticking to things. Like that's a really simplified version, but there's no harm in ketones though. Ketones don't harm you. Ketoacidosis is another thing, like for diabetic type 1, that's different. But for people that don't have that, it's not, you have too much ketones, then your body just gets rid of it in urine or breath. Like it's very clean. And it only takes like um, half of the steps to create energy from a ketone body than than glucose. So it's really, they're great, aren't they? And I call it the secondary fuel source, but why not be the primary if they're so amazing and they can heal your gut. They're signaling molecules
Yeah.
too. Like they signal glutathione, which is our antioxidant. And like if we have our own antioxidant, our body makes their own antioxidants. And so and it makes their own glucose too. So Georgia Ede always says, why wouldn't you trust your body? Because
Yeah.
your body's so intelligent. Trust your body over your own dietary. Oh, I need glucose for the brain. It's like, don't worry,
Yeah.
your body will make it, in the liver, gluconeogenesis.
That's
And
right. That's
so, yeah. So anyway, you asked how you get into ketosis. So
yeah. Yeah.
low carb. And depending if you are lean, then you want to increase your fats,
Yeah.
really healthy fats though. And just people aren't used to eating like that, but it's delicious.
Yeah. It is. It is.
Yeah.
Yeah, it's amazing. We had Dr. Matthew Phillips on
Yeah, I saw that.
some time ago, yeah, and who's brilliant and has done some really great work. And one of the just breakthrough takeaways from that interview was his insight in that the ketosis arrived at from a low carb diet, a ketogenic diet is very healing. But what he found was that um, the ketosis arrived at through fasting was even more healing. And it just made me think, and I think he alluded to that a little bit more as well, is that, okay, fine, we had the ketogenic therapeutic diet for 100 years, right? Because the label's been around for 100 years.
Yeah.
And it was rediscovered, and we've had great doctors throughout the years apply it. Now we have more great doctors apply it. But when we get to our ancestors, it's like, man, we were fasting all the time.
Yeah.
It was only 1976 that the dietary guidelines changed in the United States, and kind of all the industrialized nations followed suit, and we just started loading up on carbs. We had the low fat, anti-cholesterol guidelines go in, reduce
Yeah.
those, increase carbs, processed carbs, sugars, that's no problem. And what do you know? You track it on a graph, and all these metabolic diseases, including psychiatric diseases, start to skyrocket because we our neurons just can't only run on glucose. And you've got Dr. Dale Bredesen talking about how, we've been meant to have metabolic flexibility. There are times where we're running more on glucose, times when we're running more on ketones. And Dr. Stephen Cunane talks about it. But if
Mhm.
we've been eating for 30, 40, 50 years high carb, we need some low carb time to kind of reset, like you're saying, and heal.
Yeah.
So that's powerful. Tell us a little bit about Metabolic Collective.
Okay, so Metabolic Collective is a bit of an offshoot of Metabolic Mind. So Metabolic Mind is the hubbub for anything metabolic psychiatry and You'll be happy to know they're starting to put neurology in there, sources, because it's so intertwined. Like, it's the brain, so many brain based. So this was started, like I mentioned earlier, the Hannah Warren, the brainchild, she of this Metabolic Collective. She works at Metabolic Mind, and she has bipolar 1. And her stories, man, I read her story, and it's just like my son's, like the psychosis and the olanzapine sedating her, taking away all her creativity, etc. So Metabolic Mind is a nonprofit. They don't take donations. They're not that kind of nonprofit. And also they don't have room for volunteers. So it's very research based. They have a team of employees that is creating content. So we are the offshoot that is now utilizing all these volunteers who want to spread the word. So to give you an example, and we've sort of been developing this over the last year, meeting people. We haven't done a hard launch yet, but already I've had about 100, I would say over the last year, about 100 people contact us because we were sort of down at the bottom of Metabolic Collective, like, hey, if you want to volunteer. So we're just sort of meeting people and having some meetings to help inform us. But just to give you an idea of some of our work streams right now, we have somebody, the wonderful Natasha Smichaels. She's a fellow Canadian, I might add. She's a psych nurse who discovered metabolic therapy for her ADHD. And so she is sort of leading one of the work streams where she's creating material. So if somebody wanted to present at their church or at the Rotary Club or at their school, local school, whatever, she's creating training for people and like a presentation, like a PowerPoint where they can use it and add their own slides. And so that's an example of one work stream. And another work stream we have led by Robin Dobbins and Stephen T. So he has a YouTube channel as well. And they both had bipolar. He had substance abuse disorder, and putting that in remission with metabolic therapies. And boy, Stephen eats a very high fat. His ratio is like 4 to 1. I don't
Wow.
want to get into ratios, but you could look it up. Keto Mojo has a really great information on ratios. The 4 to 1, 3 to 1. 4 to 1 is it's really high fat that they use for the children
Seizures.
that have the severe seizure disorder when they're young. But so he can tell, like he can tell the difference if he eats too much protein and not enough fat. So
Wow.
he eats the carnivore diet that he finds that the most healing diet. But anyway, they are leading a work stream where they're going to create we're just working on it now, but like a X and a Facebook group to support people using the Think Plus Smart, which I think we're going to talk about,
Yep.
framework that Metabolic Mind put together. That was the brainchild of Jan Ellison. So,
Yep.
um, and we do have a vision of connecting people. So once we start doing a hard launch, wouldn't it be great if, and I know I'll give an example. One girl I keep in touch with email, and I met her just by Zoom. She's in Rhode Island. So anybody out there in Rhode Island, and she's like, do you know anybody from Rhode Island? She goes, nobody knows about metabolic therapy. She said, you're the first person I'm talking to. She has bipolar, and she's finding relief, and she is nobody there. And so I'm like, whenever I hear of somebody from Rhode Island, I'm going to let you know. And so big picture is we connect people. Oh, we'll say there's like 10 people contacted us from Rhode Island because we got so big and everybody wants to connect. And then they create, and instead of like support groups, like that's another thing too we could consider. A lot of people have said like the AA model, where
Mhm.
you create groups to talk about it, but just create groups that might want to have a project like where they get materials together and present to clinicians or something like that, or just a hiking group
Yeah. Yeah.
or a group that likes art, just to be together. So as you're doing something, you're talking about it, you're supporting each other. especially if they don't have a household that's eating a ketogenic diet, that's going to be tough. But
Yes.
then you're like, oh, well, what do you do? So instead of it just being an awkward, I'm not saying they're awkward, but if you're in a circle and you don't, if you're doing something, it's easier to talk. So that's another example. We're also creating like a neurology focus group, and already one of the board members, she likes to stay on low key. But we know her, we're a mutual friend. She is already reaching out to like Mimi Rogers, who had Parkinsonism.
Mm.
And so she's reaching out to people that have been reversing cognitive decline, and they are telling their story now on metabolic mind.
Great.
So metabolic mind is now opening up to include the people that are finding healing
Great.
from neurological issues or Alzheimer's. And Judy, I think she's going to present. Is that correct? You would know that.
Yep, yep. So yeah,
Yep.
we connected. Yep, we connected Judy Benjamin there, patient zero, Dr.
Yeah, and you've interviewed her. So, that's so exciting. I can't wait to just see that. And so I know I can explain what Think Plus
Yeah,
Smart is. Um,
exactly. Yeah, yeah. What is Think Smart?
yeah, Think Plus Smart is I think they had a hard time to answer what is it, but they called it a framework.
Yeah,
And so if you go on to metabolicmind.org, there'll be a little tab to the right, and it's the Think Smart tab, or you just Google, Think Smart Metabolic Mind, you'll find it. But it's sort of a framework that it's like the how to, but
yes.
everybody's so individualized. So the think stands for therapeutic, like
Yep.
what therapeutic things can you do, medication monitoring, and then the that's the th, sorry, th is therapeutic. The I is integration, like laboratory testing supplements. The n is the nutritional ketosis part, the food, no, that's the nutritional, like the foods, the macronutrient ratios. And then the K is the ketosis. And SMART is just other strategies like sleep,
Yep.
moving, what to avoid, how to rebuild, and tracking. And so, but my favorite part of the Think Plus Smart, so if somebody's brain isn't quite working, I think them reading over strategies would be really overwhelming. You'd almost need a caregiver to do that.
Right.
But my favorite part is if you go at the top, it says explore strategies.
Yeah.
It's so well organized. And you're going to
Great.
see a picture of someone and their name,
Yeah.
like Emily Ann Herrick.
Yeah.
She's on X. I met her on X, and she's such a great advocate in remission from depression. And then you click on it, and she has a video of her story, short video, and a short video of what she's doing that helped relieve her depression. Lauren Kennedy West, she's the famous, has a YouTube channel. But anorexia nervosa, somebody there with that. There's OCD on there, ADHD, PTSD. And then I was telling you, which I was excited to see some of the neurological issues like Parkinsonism and cognitive slowing, autism. So these are people. And it's just so easy because to me, that's the most convincing part. You could
That's it.
read literature, right? Science. But not everybody wants to do that. But if you have a human being saying, this is what my life was before, this is what it is now, and this is what I'm doing, and each one is quite different. And so that is the Think Plus Smart framework for, healing using metabolic therapies.
Yeah. No,
Yeah.
it's great you guys have put this together. Metabolic Mind has done, the Bazuki family's done the world a great service by all the content that they've produced, all the
Mhm.
information that they've been able to distribute. But this Think Plus Smart was so needed because people need to see those inspirational testimonies. These
Yeah.
testimonies are motivating because there's a lot of hesitancy to starting these things. A lot of practitioners don't know about them. Some practitioners even advise against because they don't understand how to oversee it appropriately. So it's really great that these testimonies and this information is so well organized to be helpful.
Yeah, I just want to clarify that I didn't have anything to do with it. Metabolic Collective, the only thing we did, so it's really the Metabolic Mind
Yeah.
team.
Yeah.
But we did use some of our volunteers to
Right.
read it over before and give feedback before it came out. So that was nice. We could use our volunteers for that.
Yeah.
And a lot of those people that you're going to see on there, and they keep adding to it. They keep adding. A lot of them are coaches. So
Yeah.
um,
Great.
it's nice because if I'm referring out, I'll say, "Oh, here's a little bit about them. You can
Yep.
watch a video."
Yep.
So
Yep. Yep. Exactly. Exactly. No, that's great. That's great. Um, Really quick here, how would you like to see standard of care for psychiatry neurology change, right? It's up to you. How would you like to see it change?
I want them to offer ketogenic therapy as an option. I'm not, hey, I wouldn't mind going as far as a first line treatment. Why
Yes.
not?
Yes.
Like if I can think big,
Yeah.
I know you want to give people the options, but if you know what a healing intervention that is for your body versus just making your symptoms go, making you feel a little bit better or not, like from medications and harming you, I'd like to see this in the medical institution as a first line treatment, especially for bipolar schizophrenia and, Parkinson's, Alzheimer's, Huntington's,
Yes.
ALS, the ones that we have actually seen issues like healing and epilepsy, of course, but that already is
Yeah.
supposed to be a medical, like that is a medical intervention in the med schools, but
Yeah.
that's what I would like, but then you need a support team. So you need insurance or you need your government to
Yep.
fund it.
Yep.
I know we have healthcare here in Canada, so we would need to see then a nutritionist or dietitian that the patient doesn't have to pay extra for because you really need support and you need like especially with the medication piece if you're not on meds it's a little less you don't have to worry as much but the titrating is important because when your brain's healing your brain's going to be more sensitive and then all of a sudden you get the side effects of the medications when you didn't have them before
Yep.
and then people think oh that's the keto diet it's like no it's not it's the medication is too much right now but
Yep.
so that's my big picture for care I hope it comes in my lifetime,
Let's
because
do
so
it.
many people are suffering and I just think about it a lot. It's just,
Yeah.
it has to be normalized.
Absolutely. Absolutely. Well, I'd say let's do it. In our lifetime, I think it's very possible. I think information is spreading faster than it ever
Mhm.
has. I think at the same time, a lot of people are in the pain and suffering of not getting the results that they would like to have within standard of care. And every day, I know more and more practitioners are getting trained on these therapies. And what you're doing today is helping that tremendously. Just everybody, it takes a village. We all have to come together and spread the word and help just provide information to those who can use it. And I think some pretty remarkable results are going to keep compounding here in the next few years. It'll probably come sooner than we think. Um,
But just Eddie, like the other thing I guess is because I teach high school and there's a lot of kids suffering.
yeah,
When are we going to stop this, um, the way we are eating? Like maybe we could prevent these, right?
absolutely.
You know,
Yeah,
like the way people eat, especially teenagers,
yeah,
it's not good for their brain. And
exactly.
so that's another thing. Like, yeah, okay, I have ADHD. It was like, do you have ADHD? Or is
Yeah,
it just that your brain is starving for energy right now? Like you don't have enough micronutrients to, but
yep,
so yeah, there's a lot to think about. I don't have the answers how we can change this from the very beginning, like feeding our that's a huge question, isn't it? But yeah.
it's huge. It's huge.
Yeah.
Yeah, I mean, there are so many government incentives in both Canada and in the U.S. to subsidize um, processed food, and it's cheaper and it's
Mhm.
more accessible. But I'm seeing more and more people come to understand the pitfalls of just eating processed food. And for my family, like, look, we didn't know about nutrition until my dad got sick, and then
Mm.
my whole family was transformed by it because we're looking for answers. And now, oh, this diet can help them. Let's try it out. But let's first us try it out. Now my family has been transformed. I think there's a lot of families like that, and they're learning that you're right. It's what starts with what we put in our mouth. And unfortunately, that means we have to make different choices with what we buy.
Yeah.
And it's more expensive. But, like I heard I really feel it now because we're living it. It's like you either pay for your health now or you pay for it later.
Yeah. Yeah. How
So
do you feel? Like, how does your brain feel?
I
Have you?
feel I feel great. I mean, I tell you, like, it's one of those things where, I'm 34, right? So I didn't have decades of wear and tear, but I started on this path with my father in my 20s, and um it was one of those things like Dr. Mark Hyman talks about, sometimes it's like the tack in your foot. You don't feel it until somebody removes it. Uh,
Yeah. Right.
and
Yeah.
and for me, when I started eating this way, it was like a fog lifted. It was like more productivity, more creativity came, more energy. Um, and you kind of, it's almost like you wake up from a dream and you're like, wow. And then you try to go back to that way of eating and you feel so bad that,
Hmm.
and then you have so many, for us it's like, man, we have a three generational household. I got my parent, I help caregive for my father, and they have an in-law suite in our home, and then we have two young children. I got another one on the way. We got so it's like you got so many things and so many people depending on you. You can't afford to have bad fuel. You have
Hmm.
to eat good fuel to get you through. So yeah, like, I'm totally with you. It it takes a different choice in what you buy and what you eat. Um, and there's trade-offs to that. And going back to what you said before, it's got to be patient-led. If we teach enough people and they buy in, then they're going to vote with their dollars.
Yeah.
And consumer demand will dictate consumer supply. And
Yeah.
maybe we can get enough people where the regenerative agriculture and organics starts to grow and it becomes cheaper and it becomes more accessible. Um, it's going to take a little bit, but I think what we're doing here adds to that.
Hmm.
Yeah, yeah.
Yeah.
But hey, look, if somebody wants to volunteer and help out Metabolic Collective, get involved, how do they start something like
So
that?
yeah, we are metaboliccollective.org. I think if you just do Metabolic Collective, I don't know if it takes you there yet, since we're semi-new. So metaboliccollective.org. We're going to be putting some of our work streams on there soon, but you'll see the team. We have that on the website and just a little bit about what we're about. And there's you scroll down or it says want to volunteer or something like that, just fill out the form. It just sort of shows your interests, your skills. Maybe, if you want, it says, why are you interested in metabolic therapy? And that form will come to me. And then I respond to all the forms and, I'm going to bring on some more volunteer coordinators to just sort of meet with everybody, but that's where we begin.
Okay.
And then as we grow, we can utilize more. But yeah, even just right to say hi.
Okay.
And
Great.
yeah.
Great. Well, hey, one more question. I want to honor your time here, but what's one step you'd recommend to every listener to improve their mental and cognitive health after finishing this interview?
Yeah. Honestly, when I say if I work with people that are on a high carb diet, I love the Vinnie Tortorich no sugar, no grain. It's so simple. And that's helped. I know my friend Robin Dobbins, that's where she started. And that's what I said to somebody. Just they're like, oh, come on, I was doing a case study for my school. And I said, it's gonna take me a while. And she goes, just tell me anything. So I said, okay, no sugar, no grains. And so, wow, within a couple days, so many little things were improving and over time. So that's a good start. If you are high carb, high sugar, you don't want to jump right into a ketogenic diet. So, oh, there's so many, but that would, I like that little first advice. It's so such a simple message.
Yeah. Yeah, definitely, definitely. It's a great little baby step, and I think you get hooked after that when you feel the way you feel. Uh,
Yes.
yep. Where can people find you and your resources?
So my website is purelyjanet.ca. I think if you Google Purely Janet, or it's Purely Janet Holistic Nutrition, and it's very ketogenic based. So there's a lot of resources on there. There's a lot, you know, even just for you to find other resources. If you want to touch base with me, then there's a little, I have an email there, Janet at purelyjanet.ca, or you can fill out the form if you want to say hi. Love talking to people and connecting, especially people in Ontario, Canada, because we should start our own movement here. You know, wherever you are, grassroots movement, and I think that's going to be powerful.
Yeah. Yeah, beautiful, beautiful. Well, look, Janet, great. We're gonna link all that in the description below so people can go ahead and get educated on there. I love your website. It's so well organized and it's a great place. You got like a little resources page there that can take you
Hmm.
places that whether it's metabolic neurology or metabolic psychiatry, people can get educated, and that's what we need. So, look, thanks for making the time. I know you're busy, and but you made the time and shared your story, shared Metabolic Collective's mission, and I know that this is going to help a lot of people. It's going to help instruct people where to go because I think that's the biggest issue that all families face is that if you do have a desire to get a second opinion because you don't like the prognosis or you don't like the treatment path that you're given and it's not working, well, where do you go now? Who do I get information from? And what you're doing is helping that tremendously. And you know, everything you've done to help your son and help your family, you're sharing with everyone else. So I'm um, I can I can really identify with that, and I'm grateful you're doing it. So, thanks, and I'm looking forward to connecting with you down the road.
Yeah, thank you so much, Eddie.